Welcome back, listeners, to Drug Diversion Insights. I am so looking forward to this podcast today. My guest is Dr. Stephen Loyd. 15 years ago, when I first entered the world of diversion mitigation and monitoring, I was asked to present during Patient Safety Week on a pharmacy-related topic that impacted patient safety at the hospital where I was employed. I spoke on, guess what, drug diversion. My goal was to educate all the staff present that substance use disorder happens to healthcare professionals, and we all have an obligation to be aware of that fact and to protect our patients from it. In my presentation, I spoke of real cases that I had read about in the media. I wanted to name names and make people come alive for the listeners. Well, Dr. Loyd was one of those cases that I presented. I'm going to let you tell your story today, Steve, and welcome to the podcast. And so let's start by telling us your story. Start at the beginning. If I recall, it was residency that was the main focus of your story, but I'm guessing it might be earlier than that.
First of all, thank you for having me. And when you told me that, I was smiling because I never think of myself being presented as a case, but it is. And so I'm glad that you ran across it and it brought us together. And you're right, it didn't start then. I had grown up in Northeast Tennessee, rural Appalachia, a little town called Jonesboro, quite picturesque, by the way. I came out of a place where, a family that was riddled with substance use and mental health issues, basically in my family tree, and then childhood trauma. I'm a survivor of both physical and sexual abuse, and not, those aren't excuses. It's just, is what it is, and had no idea of those things being risk factors for substance use disorder, which those are actually the two biggest. And so I was never a successful drinker. I wasn't a drink in my hand all day type guy, but through high school and college, when I drank, and and I would go long periods of time where I didn't, and so I always knew that there was a little bit of an issue there because I didn't drink like other people. And when I got to medical school, the most impressive bunch of people I'd ever met in my life were my classmates, still are, and I love them to this day. And our second day of med school, they elected me their class president, and I couldn't let them see me drink. Because I did not want to embarrass them. And so I didn't drink for 4 years. And that's kind of looking back on it, realizing the importance of community relationships and support systems, because I just put it down. And then graduation happened, and they kind of went to the four corners of the earth for residency. And, we got about our lives as young physicians. And within a month, I was back drinking intermittently again, and about a year before I picked up the pills. And I was on my way home from work one day, my last year of residency. 4 years of med school, 3 years of residency. So I was the chief resident in the last 6 months of training, and didn't like my life very much. Right, a lot of stress. I thought I was anxious, depressed, and didn't like my wife very much. I'm still married to her, by the way. Problem wasn't her, as you might have guessed. Young kids, and nervous about coming out of the protective environment of residency, and stopped at a red light on the way home from work one day, and flipped up in the glove compartment of my truck, and there were some Norcos in there, hydrocodone, acetaminophen. People know them as Vicodin. And, I had this conscious thought that, my patients take these things all the time. I swear that happened. And I reached in, pulled it out, and got it from a dental visit. Broke them in half, took 2.5 milligrams of hydrocodone. And by the time I got home, my job was better. My anxiety felt better. I wasn't depressed. My kids were better behaved, and I liked my wife. A heck of a drive home. I had no idea at the time that the area of the brain that interprets pain doesn't separate physical from emotional pain that I've been carrying around for a long time. And so I went on a run from there for about 3.5 years, almost 4 years, and went from that 2.5 milligrams of hydrocodone to about 500 milligrams of OxyContin and 8 milligrams of Xanax a day. And nearly took my life.
Yeah, absolutely.
The weird thing is that when I started that, I had no idea that this little thing, right, that came from a dentist, and it wasn't a dentist's fault, by the way. I'm not casting shadow there at all. I had no idea that it would be something that I did not think I could live without. I knew a tiny bit about addiction. We're not taught hardly anything about it in medical school or residency, which I find ironic. But, just no clue that, hey, just in a very short period of time, you're going to require so much of this, you're going to have a hard time getting it. And if you try to stop taking it, you can't. And I just didn't have any concept of that.
Yeah. You touched on a couple of things. One, the risk factors for substance use disorder. I mean, that should be taught in medical school as well, because as you're prescribing for patients, let alone, your own history, that would be good to know, right? And I think, so many times I have heard the message that you recognized that you were unhappy and anxiety and depression and all that kind of stuff. But I've also heard from other people that didn't recognize that they had this level of it. But the first time they were exposed to an opioid, it was like, whoa, my world is different. And that is a message that I would like to see get out there, so that, if you're one of those people, and this is you think that this could never happen to you, right? But then you take something and then you have that feeling, that's when you should be like, uh-oh, I need help now. Like, let me tell somebody before this becomes something that you are ashamed to tell and don't want to mention it, right? Because now it has destroyed your life. So I wish we could get that message out.
Well, it's the message really I've been working on for a little over 20 years now. As I started to learn about addiction and treatment, and treatment is a really, really fancy word for rehab. I was a professor at a medical school. I was so lucky because my boss, the dean of my medical school, Ron Franks, who I love to this day, was an addiction psychiatrist. I mean, you talk about a fortunate set of circumstances. That's, and he didn't fire me, and he got me help. And as I learned about addiction, I really knew what I wanted to do in medicine. And I remember sitting there one day, still in rehab, and I thought, if I can do this, and if I come out on the other side of it, I know what I want to do for the rest of my life. And I had that thought within the first 2 weeks. And like I said, a little over 20 years ago, almost 20 and a half years now, and I have followed through on that. Prescriber education has become a really important thing for me, because I didn't run a pill mill. I didn't prescribe a bunch of pills to people. I was using them myself. And the truth is I didn't understand anything about the risk for my patients. And so I took a class at, luckily I live in the state of Tennessee, and Vanderbilt University is here. They have a class on proper prescribing controlled substances. So we actually do teach our doctors and nurse practitioners and physicians assistants about it, but we teach them about it after they get in trouble. And I just think that is the most asinine thing ever. But I remember, taking that class and going, wow, how come we weren't taught this in medical school and residency? And the guy who put the program together is now deceased, but he's on my medical Mount Rushmore. His name is Andy Spickard. And Andy told me when I was leaving there, I was the only person there not sent by my state medical board because I didn't get in trouble, and I wanted to learn. And he said, Steve, he said, you're still a professor back in East Tennessee. He said, go teach this to the kids. And I did. And I also made a career out of it. I became an expert witness in federal drug cases against doctors running pill mills, and have worked over 25 of those now in the last 20 years. And so, used what I learned to stop bad people from doing bad things, because these are criminals.
Right.
And also, I become a much better doctor myself in realizing risk factors and then helping other prescribers.
Right. Okay. How did you, as it progressed, how did you get your hands on more? Did you just write your own prescriptions?
No, I never wrote my own prescriptions, and frankly, that question scared the heck out of me, because when I got to rehab, I realized the premise of it was two things. We're gonna tell the truth, and we're gonna be comfortable with confrontations. And I almost ran. I would have run. I wasn't going to do either one of those two things. And so I knew I was going to have to come clean about it. And one of the tenets is that we're going to get honest in all of our affairs. And I remember sitting there thinking, most of them, I added the word most. And so I realized with time, though, that that the only way to get better was to own everything. even the difficult things. And so I did. And you got to keep in mind, I wasn't in trouble. I didn't get sent to treatment by the DEA or my state medical boards. I self-reported. My dad confronted me, and I knew I was hurting, and I knew I was dying. And so I just became willing. I didn't care if I lost my license because it wasn't going to do me any good if I was dead. And so, coming to that realization is a really big thing. But, how I got them at first out of people's medicine cabinets. So it's one of the things I always talk about when I'm doing diversion talks. Doctors write you 90 and you need 10. Why do they write you 90 when you need 10? Well, so you won't call back. So we have to get honest about that, and realizing that those things go in people's medicine cabinets, and from the medicine cabinets, they leave. If you think people don't go through your medicine cabinet when they come over to visit, you're living in a dream world. And so that was the initial source. But it got so big that I eventually had to go to the street. And that's one of the things, if I ever get frozen in my own shoes now, that one's the one that scares me, because that was 2000, 2001, 2002. Fentanyl wasn't around.
Yeah, it's
And
very dangerous now.
yeah. Yeah. So what I was getting off the street was real, coming out of a pharmacy. And I had somebody ask me not long ago, hey, Steve, if you had been like this back, if they'd had fentanyl back then, what do you think? And I said, I think I would have died.
Yeah.
And that scares me. But I'll tell you another source. People don't realize that 70% of the people who get started on prescription opioids don't get them from a doctor. They get them free from friends or family. And so drug take-back programs are very effective in stopping that initial use. And then, my buddies, right? I mean, all my buddies were doctors, and they knew me, and it's like, oh, well, there's no way Steve would have a problem here. And we're not supposed to regret the past. I'd like to change that one. That one I think about, because my friends really thought they were helping me, and I took advantage of that situation. And I'd like to have that one back. Although they're great, they've been supportive of me, as how people are good, they really are. And but I'd like to take that one back. But those were my sources, because I was using 100 pills a day.
Yeah, that's a lot. That's a lot to get your hands on. You'd need to make a lot of new friends and get into their medicine cabinets if you were doing that.
It's weird. It is a lot to think about, but it really, it wasn't difficult. But the problem was that people don't realize this doesn't take a break. So when I get up every morning, before I go to bed that night, I need 100 pills. Yeah. And I got to do that every day. And if I go on vacation, it doesn't take a break. I need 700, right? And so people get on me now about how much I work and what all I'm into. And I kind of laugh, because I feel like I got all kinds of time, all right? Because I'm not preoccupied with that continuum. You bet.
Yeah.
You bet.
Yeah, definitely. So you talk about, your friends helped you with, they thought they were helping you. Were there signs that they should have seen, or if they didn't work with you directly, the people who did work with you directly, should they have seen either a change, or maybe you out of the gate, you were that way since it started at the end of your residency? What did people miss?
Well, when I say this, I don't want it to be, casting blame on them for missing things. I mean, I want to make that clear. This is clearly me, and clearly, on me. But yes, when I do this now, because I kind of do some of the things that you used to do. And when I'm educating folks, companies, like large companies, that I get in front of and try to help them with employee assistance, my standard go-to line is this. When you're sitting there as an employer and it crosses your mind that your employer is just not the same person they used to be, when that thought crosses your mind, at somewhere in your planning process, you need to ask about underlying mental health or substance use issues, because I'm telling you that's going to be the most likely cause. And it's not always going to be the cause. You and I both know that. But you have to ask about it. So there were a lot of things. My nurses, who I love to this day, would bring stuff back before me. I would miss stuff, right, that I didn't normally miss. At the end, because I never was one of those people in the hospital that was a horse's rear end, if you know what I mean, right? I didn't yell. I didn't throw
Right.
scalpels. That wasn't me. This is actually, I was still like this.
Mhm.
And so what they wound up doing was making excuses for me. Oh, he's tired. He's working a lot. He's got multiple jobs because he's trying to pay back his med school loans. And I got behind on my documentation, and that was really the big one because I don't leave until my documentation is done. Mainly not because I'm just a goody two shoes. I can't remember what I did. And
Sure.
so I would never leave until all my dictations were done. I'm going to date myself talking about a dictation, but at any rate, I never left, and those things started to pile up, and I would get weeks behind when I would never get even a patient behind. And I started having an erratic work schedule, canceling clinics, moving things, and then at the very end, being involved in administrative wars. Just everything was everybody else's fault. And, they're treating me this way, and I really started to go downhill. But luckily, my dad intervened pretty quickly. But there were a lot of things that folks, looking back, would tell you they should have seen.
Yeah. Did they have you talked to any of them post the fact of you, asking for help where they said, "Yeah, I knew something was going on, but I didn't want to think about it," or "I didn't want to confront you," or "I didn't know how to confront you"? Did anyone say any of those types of things?
Almost all of them,
Okay.
they were so supportive. I mean, it's really. I'll get emotional thinking about it because they were so supportive of me.
Yeah.
Because I was sure that I was done, and they were just wonderful. But yeah, we've talked about it a lot. Matter of fact, I mean, I told you it's been over 20 years, and I did a talk for the School Board Association here in Nashville. When was it? About 3 weeks ago. So I had every school board member in the state of Tennessee there, about 1,000 of them, and in the audience was a school board member who from my home county who coached baseball with me when our kids were smaller, and he had never heard the full story. And we were walking to the car afterwards, and he put his arm around me, and he was almost crying. He said, "Steve," he said, "me and JP was the other guy who coached with us." He said, "Me and JP saw stuff." And he said, "We knew," and he said, "We just didn't say anything." And I
Mm,
told his name's Todd. I said, "Todd, that's not on you." I said, "Not on
yeah.
you at all." And he said, "We didn't want to hurt your career." And this is kind of how the conversation goes from that
Mhm.
end. "We didn't want to hurt your career.
Yeah.
We thought that we were, be outside of our bounds and those type of things." And so you got to realize there's a power differential there as well, particularly for my employees, because I'm the
Yeah.
physician and
Yeah.
I drive the practice, and I've got to be okay for the practice to be okay. And so therefore I'm okay. And
Right.
and that's where some denial comes in. But no, we've had multiple of those conversations. So ironic you mentioned that, because that one was more than 20 years ago, and that just happened 3 weeks ago.
Oh, wow. Okay. Yeah, let's talk about that. So you're right, the power differential with a physician that changes the entire dynamic.
Yeah.
How do you teach people and recommend, if there is that power differential? Obviously, I mean, well, unless you're in a private practice, the physician has somebody above them that, they can go to in a hospital setting, of course. But if there isn't that power differential, it's a nurse or a pharmacist or somebody else that you suspect. How do you recommend to people? What do you say to them if you are concerned that you think something's going on? You may not want to go straight to substance use disorder, but how should they confront that person?
This is the weirdest thing, because if you ever told me that I would do this in my life, I would say that you've lost your mind, because it made me so uncomfortable. And because it could be something else, right? There's medical issues, there's
Yeah,
private issues, family issues. There's a lot of things, and I never want to come across as accusatory or judgmental.
right.
And I will tell. First of all, I'll tell you what doesn't work. Getting somebody in a room and having everybody write down how that person has made their life a living hell, and what a rotten piece of crap they are, and reading it to them, that doesn't work. It makes for great TV. But if you watch the end of those TV shows, most of the time those people just leave, and that doesn't work. For me, what has worked is kind of a little bit like you and I are right here, right now, and I'll just approach you and think, hey, I got no idea what's going on, but I got some things I'd like to talk to you about, and I want to make sure you're okay, because some of the things I see right now, don't look like the person that I used to know. And I got no idea what it is. You know, it may be nothing. It may be, you know, hadn't slept well lately. But, you know, is there anything at all going on that you may need help with? And that's how I always approach it. And I tell people all the time, you know, particularly when I'm in front of companies, and I do a work with this huge law firm that does employment work all around the country in all different sorts of industries. Last time I did something for them was the airline industry out in Denver. And, you know, I have a huge problem with this with flight attendants and pilots, right? And there's high stakes there, right? Particularly if you're talking about a pilot, and you've got to be a little more aggressive in those situations. But in this situation, it's just about giving them an avenue. And, you know, people are basically two varieties. There's the bright light variety, and that was me. You know, when my dad confronted me, I mean, I felt like a guy was out in the middle of the ocean drowning, and all of a sudden a boat showed up and slung me a life preserver. And I grabbed it and I cried and thought my life was over. But gosh, I was so glad somebody knew. I mean, just relieved. So that's a bright light variety. Others are what I call the slow drip variety. And so they may have that go on that day and say, no, Steve, everything's fine. And okay, I just want you to know I'm here. And I've got some experience with this myself. And sometimes I'll share my own stuff, and it's out there so much, a lot of them know it anyway, to let them know that it's possible. I used to didn't think that recovery was possible. I never saw anybody, you know, stop drinking or stop using drugs. I saw them all die, or, you know, their family kick them out, or whatever. I didn't see anybody get better. And so I let them know that's possible. And then, you know, if you ever need help or decide you want to talk about it, I'm here. And that's basically what we can do. We like to think we're in a whole lot more control than we really are, and we're not. Now, if you're in a hospital setting or that pilot setting, well, you got some leverage there, right? And you're looking at the potential to do harm to multiple other people. That's a different scenario. But in the scenarios we're talking about, this is the approach I use.
Okay. Yeah, that makes sense. Well, and for peers, you know, I mean, some are they're hesitant to say anything because they don't know. So they may want to start with that one-on-one interaction before they go to their supervisor. I was talking to some colleagues just the other day, and one of them was sharing how they had a case at their hospital, and come to find out, like 5 peers had told the supervisor, and this had been going on for quite some time, and the supervisor did nothing about it. And, you know, our response to that was, do you know how hard it is for a peer to come to the supervisor? If they're telling you, and it's that many that are telling you, you know how long they've been thinking about this and talking about it amongst each other, right? So, you know, did one of them, I don't know, approach the person and express that concern? And, you know, as a peer to peer, would you recommend that after that first approach and they, you know, turn you away? No, I don't have a problem. Okay, I'm here. Would you try again?
Oh, absolutely. No,
Yeah.
absolutely. And I've done it. And it's really strange because and how people react. And I tell folks this all the time. Sometimes they react very violently, you know, and yell and in denial. And I always kind of smile underneath because it doesn't bother me. Well, you know, some of it bothers me, but I know what's behind it. And I tell my buddies, I say, you know, somebody cussed me out today that we're going to wind up being really good friends, right?
Yeah.
And I have to keep that in mind. But no, I've been back. You know, I have said, okay, you know, here's where I leave it, right? I'm here. This is what I see. This has been my experience, and I will help you no matter what. That is true, and the people who know me know that's true. And then, you know, and then we go on for a little while, and everything's okay, because sometimes when you're in the throes of addiction or substance use, you're scared when the heat's on, but then when the heat gets off, suddenly you don't have a problem, right? And so those interim periods there, then, you know, I tell people all the time, I hope I'm wrong. Golly, I hope I'm wrong. I hope you come for me 20 years from now and go, Steve, you were dead wrong. I'm so glad. Okay. But here's what I see. And so I've been back multiple times. And now if it's an instance where somebody has the ability to inflict harm on others on a scale, that is a different scenario, right? If I'm talking to a cardiothoracic surgeon, for instance, that's going to be a little bit different. All right.
Yeah.
But from peer to peer, it's that I have been back multiple times, and never judgmental. I mean, when we get into the judgmental business, that's when we start to lose people. And you got to remember, there's the stigma that goes with addiction. There's the fear of I'm going to lose this, I'm going to lose that, and so I have to understand that when I'm talking to people. Well, you lied to me. Well, I kind of expected that because of denial. I have got to do this or I lose this. And so I try to keep those things in my mind. And I've been back multiple times. But I tell you, my experience has been when I've been back multiple times, usually, the second or third time, I'm like, this is consistent and this is the rail that I see you on. And my experience has shown me that if this continues, here are some things that can happen. And sometimes that'll do it. And then other times those things actually have to happen, and they come to me when they're in a bind.
Right, right. Yeah. And that's something that those of us that haven't been there, we know that when you're in that moment, there's a lot going through your mind, and we can, kind of list some things that we would imagine would be going through your mind, but we can't quite grasp that. So let's talk about that. When you were confronted by your dad, there must have, you're looking at your whole future, your life, swirling in front of you. What is going through your mind? What did when you finally confessed that, yes, I have a problem, and you decided to admit that and then get some help and do something about it?
Well, Dad showed up at my house after an event. He saw me take a bunch of pills, and
Okay.
so the next day when I got home from work, his truck was sitting in my driveway, and as I was driving up, because I live on a hill, and as I was driving up my driveway, I knew what he was there for. I mean, I knew it, and
you knew that he had seen you the day before.
Yeah. He saw me take them, and literally he was right beside of me, and I took 15 of them. At one time, 15 Percocet. That's a lot. 150 milligrams all in one swoop. And he said, Steve, he said, did you just take a handful of pills? And I looked at him. I swear to God, I said no. And he just saw me. All right. And so he I look at it and laugh now, but it's sad. Right? Really sad, because Dad would have helped me right then. He would have. I just couldn't let him. I couldn't let him see me like that. But he put me in his truck, and we're going to see my sister, and we're driving up the road, and he said, Steve, he said, do you have a drug problem? I said, no, Daddy, I don't. I said, I'm working a lot. I was trying to pay back my med school loans. I was taking call, 1 out of every 3 nights where you don't sleep, and I said, I'm just worn out. He put his hand over on my knee, and he said, Steve, you have a drug problem. And he was crying. And that was not a question. That was a statement. And I said, yeah, Daddy, I do. And what was going through my mind right then was this. And I actually told him, I voiced it. I said, Dad, I'm going to lose my medical license. I'm going to lose my house. I'm going to lose my wife. I'm going to lose my kids. I'm going to lose everything that I've worked my entire life for. And he didn't tell me I wasn't going to, because I didn't know. And he said, yeah, he said, but none of that stuff's going to do you any good if you're dead. And I didn't have a comeback for that. And it's been, 20 plus years, and I don't have a comeback for that right now. And so almost immediately, despite the tears and everything I had going on, I felt just a tremendous sense of relief that somebody else knew.
Yeah.
And it
that's
was,
often
it's hear. Well, that, you and I both know this. That was a gift.
Mm-hmm. Yeah. Doesn't necessarily feel like it at the time, but it is, because it's the beginning. It's the beginning of that recovery piece. Yeah.
Yeah. That moment for me was the first time in 4 years that I'd had any hope. And I look back on it because, sometimes I tell this story and there's people around, and right now it's quiet and it's just me and you. And, that is a life-changing moment, that moment right there. I didn't tell him, I didn't deny it anymore. I felt relief. And then now, there's a lot of hard work ahead, a ton of hard work ahead. Right. But that was really the key.
Yeah. Yeah. I've heard it said before, and when we talked previously, you mentioned this as well, that work is the last place that you will see the signs exhibited. So my question for you then is, if somebody doesn't have a relationship with them outside of work, are there things that we could do? I mean, do we just have to wait then until it escalates to that point? Or maybe the message is just that if you're seeing things at work, it's probably really progressed.
Yeah. That's really the message, because the truth is even without substances, we don't know what goes on in people's lives. We don't, because we're guarded. I had my counselor that I love to this day, Chip Dodd, tells me, he says, Steve, if you're a failure inside the walls of your own house, you're a failure. And we don't want people to know that. So it's very difficult to penetrate what goes on behind closed doors. So my message to employers is if you see things at work, this is down the stream some. Okay, this didn't just start yesterday. This isn't because they woke up on the wrong side of the bed or their kid got in trouble at school. Okay, if you're seeing things at work, this has progressed, because it's the thing we hold on to, is work. And there were so many things that happened in my private life that if they'd have happened at work, somebody would have intervened a long time ago. But work was the last place that it shows up. So I don't know how to do that. You get into this thing is, can families speak up? Would a family seek out an employer to help them? Not likely, because they're afraid of their livelihood. And it's like employee assistance programs. And I told you about this. I love EAP programs. I don't think people utilize them because I don't think they trust the fact that their employer is not driving it and will know what's going on. And I think those are very difficult things to overcome, because it's your livelihood. It's how you provide for yourself and your family. It's difficult.
Very true. Yeah, that makes sense. All right. What were the consequences for you once you admitted that you had a problem? It affected, you went into treatment, but you had mentioned you weren't caught. So from a licensing perspective, were there any consequences? No. Okay.
Fortunate for me, I lived in the state of Tennessee, and we have one of the strongest physicians' health programs and one of the most respected physicians' health programs in the country. And so, I self-reported. I got world-class help. It's really kind of neat, neat way to close the circle. But 5 years ago, I got appointed to the Tennessee Board of Medical Examiners. And, I should be in front of the Tennessee Medical Board, not on it. And they didn't know. Those of them that knew me, right, and not everybody on the board knew me, but those of them that knew me knew, because I've talked about it publicly for a long time. But I didn't have any disciplinary record. I did not get in trouble. I did not get decredentialed from my insurance companies. The dean of my medical school, Dr. Franks, and the president of my university, Dr. Paul Stanton, never fired me. I got paid every day I was gone. And these things for me were blessings and gifts that I do not take for granted, because most people don't go that route. My consequences for me were mainly, family relationship things, fences I had to mend. And some of those fences you don't mend by saying, I'm sorry. Some of those fences you mend by living your life differently from now on. Right. And so, I had those things. Probably from a career standpoint, I just didn't have very much. Within 2 years of getting help, I was on the academic track back then, because I wanted to be, I wanted to be the dean of our med school. But I was an associate program director for the residents, and within 4 years, I was director of the residency program. So I was over, all the different ologies, gastroenterology, cardiology, you name them. I was over all that. I later went on to become the chief of medicine, the chief of our hospital. I just did not have those consequences. When I had to talk about, the things around, prescribing medication and some of the things I did, I had to tell some people that could have thrown me in jail what I'd done. And, I wound up working for them. I still work for them today. The DEA of the United States, the Tennessee Bureau of Investigation, the Commonwealths of Virginia and Kentucky that I have worked drug cases for. Really, I don't think you could draw up really how my life has been. So I didn't have those consequences. The consequences for me were this. I I went to bed half the nights during that time praying I wouldn't die, and the other half praying I would. And people say, well, you didn't have a very low bottom. Well, I don't know how you define low bottom. Did I go to jail? No. Did I get in legal trouble? No. Did I lose my job? No. Did I alienate my family? Yes. Did I lose trust, from my kids and those closest to me? Yes. Did I hurt my friends? Yes. I did all those things. And I got very, very scared of losing my own life. And so I had the consequences that I needed to get me where I needed to be.
Right. So that worked for you, definitely. I mean, you've been sober for, I think you said 20 years at this point, and you're doing some really good work. What are your thoughts on, because there are others that would feel very differently and feel that, well, no, you did steal, you stole from people, and you got, people to write prescriptions. So there are those that would be very adamant that your consequences were not enough, that you should have experienced more and should have been reported. Can you separate yourself from, this Steve that went through it versus, what would you have to say to those people?
They're right.
I think you should have. Okay. All right.
They're right. That's right. I went, I guess it was about in 2014, 2015, there was an investigative reporter for the NBC Today show. His name's Jeff Rawson. Called me up, had heard my story, and they were doing a story on the guy who they wound up doing a mini series on called Dr. Death. And it was a very popular, mini series. But he was a surgeon in Texas a neurosurgeon who had maimed people while under the influence, and the Today Show was going after him, and they wanted a doctor to talk about their own addiction, and I did that live on camera, and I told the truth, and he asked me at the end. He said, what if there are people out there that you've harmed? Well, there's accountability for that. And the people who say that are right. I'm a doctor, and I think I had advantages that other people don't have. And so I certainly see how they feel that way. I'm not sure what they want me to do. Do they want me to fall on the sword or whatever? Mm-hmm. And if, if that'll make you feel better, but they're right.
Mm-hmm. Yeah. Well, as I said, it worked for you, the consequences and your own drive so you came out of it on the other side doing a lot of great things and using your story to really make a difference. So that part is definitely good. What are you involved in now? You're doing some advocacy work, policy changes. You've mentioned some of that throughout this podcast. So tell us a little bit about what you are doing.
Well, the mission and the goal every morning, it never changes, is to help as many people find recovery as possible. That's it. I really don't live by any other credo other than that. And that's taken me a lot of different places. I have more jobs than normal human beings, I guess. I'm I guess the unofficial title is the drug czar, but the director of the Office of Drug Control Policy for the great state of West Virginia, which I have thoroughly enjoyed. The sense of community in a state that has been absolutely devastated by this is really amazing. And so I love that work. I'm the president of the Tennessee Medical Board. I got elected president at our last meeting. I chair the Opioid Abatement Council for the state of Tennessee. So we've got about $1.2 billion over the next 18 years, now 17, to abate the opioid crisis from the lawsuits. And so I chair that council here in Tennessee. We've got a meeting a week from tomorrow. I still do work. I was an expert in the opioid settlement cases that brought this money to individual states. So I worked for the lawyers who went after industry, both the pharmaceutical industry, distributors, manufacturers, and individual pharmacies and physicians. And I still do that work because there are still parts of those cases that are ongoing. I still serve as an expert witness for the federal government in cases against doctors for improperly prescribing controlled substances. And I've done that for almost 20 years now. And, the thing that I probably do more than any other is try to give a voice to to addiction. I have been fortunate. I had MD after my name. I got world-class treatment because I cost too much to kick to the curb. And my advocacy work is around giving access to everyone that I had access to. I got help with trauma that I would have never touched. I would have never touched those things. And I want to do my best before I check out of this world to make a difference and help people out there who are victims of that, who went down this road, who don't have the resources I did. And so the goal is to establish a system of care that makes that accessible. So other than that, I don't do very much. I don't have hobbies. I don't play golf. I don't fish. I probably need some hobbies. I love college football, but if you can't find me, it's not because I'm doing those things. This is what I do. And I know this will sound weird or maybe even trite, but I feel like this was the path in medicine that I was supposed to do.
Yeah. Okay. Well, you're certainly doing a lot with it in your experience. And it's nice when you see somebody that, goes through hell and comes out of it doing something with what they learned, right? That is the bright side. Is there, over the past 20 years, are there certain things that you do to continue to stay healthy and in recovery?
Yes. Boy, I wished I could figure out which one of them were the ones I needed to do so I could trim some stuff. But, physicians are, for the most part, when they have issues like me, they're under a 5-year contract. And there's certain things they have to do with attendance at 12-step meetings and caduceus and drug screening. And I got done with my 5 years, more than 15 years ago. And I had never done that well in my entire life. I felt better. So I just kept doing them. I still do all those things today. About 10 years ago, I decided that it was time to start taking care of my physical self. I'd gained weight. I was on blood pressure medication. And I decided that the road to recovery gets more narrow the longer we go. And so I made health and nutrition a part of my recovery. And so, I lost, close to 60 pounds with exercise and nutrition changes. And I continue to do that today. I travel a ton, but my routine doesn't change. I go to meetings when I'm on the road, and at 6:15 in the morning, you will find me at whatever the nearest Orange Theory Fitness is. They're all over the world, and so I'm in there. I need to be a spokesman for them. They need to pay me. But I'm kidding, not at all. But, those are the things I do. I take care of myself. When it gets dark, I go to bed. I get up the same time every morning, regardless of whether or not it's the weekend. And I spend time on my own recovery every day. And because if I'm not healthy, I can't help anybody else. And so I've changed the entire way I live my life. And I still have things. I've had things come up, right? I still fall short on things. My goal is to, have to do fewer and fewer amends the longer I go along. So that's the goal.
Yeah, that's great. Well, thank you for sharing your story. I know that I'm even after 20 years, it's not an easy thing to talk about, I'm sure. So I appreciate that. And I appreciate the work that you're doing and trying to reach others out there, to educate and to make a difference.
Thank you, and thanks for having me. It's been an honor, and it's weird sometimes when I do things like this. I'm not in a quiet environment, and I try to be present, but there's absolutely nobody around today, and it hits a little different. So thank you for that.
Yeah, absolutely. All right. You have a great rest of your day. And listeners, please hit that subscribe button so we can keep these podcasts coming. And you let me know that they're valuable and we should keep going. All right. Thank you, Steve.
Thank you.